Welcome to Plastic Surgery Secrets Talk, the podcast where we go behind the scenes of everything interesting in plastic surgery and the aesthetics world. I'm Dr. Jeffrey Spiegel.
I'm Dr. Tower.
And I'm Dr. O'Neill from the Spiegel Center just outside of Boston. We are excited for season 3 to continue.
So we're going to be talking about DIY plastic surgery.
Do it yourself at home.
Do we like this idea?
Well, certain things, like when my patients complete their treatment with me, like when they're doing Morpheus or if they're doing, microneedling or something like that, I will give them at home procedure to do. Like I'll give them at home ideas of, the right peptides to contribute, or if you're doing a non-surgical rhino, certain massages to make sure it stays in the right place.
Almost like their physical therapy for afterwards. Make sure they do the best.
Yes, to make sure that their results come out the best. But that's about it. I think you can't take on yourself and do certain things at home, or you could create big problems. One of them is microneedling, for example. That pen, you can buy that pen at home, but unless you're constantly changing the tip of it with fresh new needles, sterile tips, you could create a big problem. The other thing is, I don't know how a person can actually go with that pen and do their own microneedling. I mean, unless you're a masochist. You can't be a sadist, but a masochist. So you're never going to get those same results as you do in a place where somebody else administers it for you. And you also need some numbing. So I don't know who's prescribing the numbing before you do that. And then there's always those rolls, the microneedling rollers. Well, those kind of have a different motion altogether. It's not something that goes in and out, but it kind of rolls, and that can create a lot of scarring, not to mention the bacteria that still manifests itself on the roller itself. So you can create actually a lot more damage than healing anything.
So and they're not so clean, right? Because you can't really sterilize those. They're plastic with little metal tips, and I strongly advise you against getting that on Facebook Marketplace, because you really don't know where it came from or who's been using it or where they found it. But you're right. When I think of do-it-yourself plastic surgery, I always think, well, gosh, I do it myself. Oh, but this means do-it-yourself on yourself. So it's really DIY-OY. Do-it-yourself on yourself. And, like what you were just saying about microneedling, if you're doing this to yourself, you can't see the area, even if you're looking in the mirror. You can't be thinking about how much pressure to apply. You can't be doing a great job for yourself because you're going to be too sensitive to, oh gosh, it's starting to bleed, or it's how deep am I going, or this or that. And you're just not getting the right effect.
And you don't have the sterilization at home and other things. So you can create a lot more problem than...
Yeah, rinsing it off under hot water in the sink is not sterilization.
Yeah, so that's about microneedling. I mean, I highly think that's just something I would not want to mess with. And
And you asked about numbing, where you're going to get it. I guess they're getting it on Temu, just like everything else.
And I don't know what chemicals are in there. But let's move on from microneedling.
Well, speaking of Temu, we saw the Hyaluron pen on Temu.
Oh, yeah.
For like $120, you can buy this pen. This is not an endorsement, by the way, for Temu. But if you are going to be getting this Hyaluron pen, this is a pen that shoots hyaluronic acid of unknown source, of unknown sterility, of unknown manufacturer, of unknown concentration, of unknown preparation, of unknown G-force, of unknown side effect, of unknown complication, of unknown contaminants into your face at unknown pressure.
Right.
Even if it says on it, the pressure.
Right. And we saw that happen years ago when people were injecting silicone and now try to get it out. I mean, there's still some patients that you're trying to get it out of, and you just can't. You cannot get it out.
No, it's when you inject these things, silicone into your face, and people, by the way, speaking of do-it-yourself, this is a true do-it-yourself thing. There are people who go to Home Depot and buy silicone caulk and inject it into their bodies. There are people who go to the supermarket.
Yeah.
Kroger, if you're in the Midwest, Stop and Shops, Shaw's, Wegmans, Publix, if you're down in Florida. These are all the different supermarkets. They buy Crisco. They buy vegetable oil. They look in the bottle and they say, "Oh, it's pretty pure. Well, I'd eat it. Why don't I just inject it into my face?" Well, you're going to get a massive, massive foreign body reaction, and it is going to do the exact opposite of what you're looking for. It's going to give you scarring. And I have people that I've seen for years where we're trying to undo these kinds of things.
And people actually injected Some people may be scared to inject it in their faces, but they inject it in their tushes. And
Yeah.
oh my God.
In the other cheeks.
Yeah.
And so turning the other cheek, exactly. Not the best thing, but there's all kinds of things we see online. We see people who came in and they said, oh, I tried to remove my moles online. I tried to remove my skin tags online. I bought this product on Temu again, maybe? I don't know. Wherever they got it, or Facebook Marketplace. And they put it on their moles, and then they say it's supposed to be gone. Well, think about this for a second. What could this be? It could only be some sort of very caustic chemical. You're talking about something like a very powerful acid that's going to burn this thing off. Do you know how much to put on of the liquid to burn off a mole? You think that's a safe thing? And just burning it off with an acid, that's going to get you a good scar? This is not a good cost savings. I mean, if you buy this acid for, let's say, $5 even, and you instead of spending $500 on getting it professionally removed, you're going to get a scar. How much is that going to now cost in years of laser and removal treatments and IPL and all the things you do to get it to look better? This is a false economy.
I used to, when in my prior career as a dentist, I used to tell patients who said, well, my insurance will only cover what they cover, and that's all I can do, which is a cleaning once every 6 months or so. And I was like, well, if you wait for your insurance to cover everything you need, then you'll be looking at root canals and crowns and all of that stuff. But they cover that, and then they cover it at only 50%. So at the end of the day, you pay a lot more, with pain and suffering too. So that same analogy, when your teeth are all gone? Yeah. So that whole concept comes to the face and really anything in life. I mean, there's a reason why we spend so many years getting the education we do so that we can treat patients correctly. And at the end of the day, you got to remember that a lot of these machines, you can teach a monkey to do them. I don't know if every monkey, but maybe like a really, like a really good chimpanzee to do it. But what if something goes wrong? Or what if something needs alterations? That's where this thing behind the skull, that's where it comes up. That's
fixing
the brain,
the problems and preventing the problems.
Yeah, so
it's kind of like anyone can take off an airplane, but landing is harder.
Yeah, so that's what our training is all about, and that's why it's, that's
I learned how to use some of our lasers with banana as an incentive, so I don't know if that's relevant.
No, that's suturing.
Oh, sorry. We do suture on bananas and apples and grapefruits and grapes even. Absolutely right. So,
we were showing them during COVID. Remember when we were running out of ideas what to and how to communicate with our fans out there?
That's true.
We were suturing at home bananas.
Showing how we do it.
Them.
Do you know that we did publish a paper a few years ago on some of these do-it-yourself beauty things that you could buy on Amazon or eBay. And the vast majority of them really don't work. And some of them do work, but they work very, very slowly. So for example, there are devices that'll put pressure on your nose to try and make it into the right shape. Now, sustained pressure will remodel your bones. It will work, but it might take several years of constant painful pressure in the spot to slightly adjust it.
Yeah, I remember my grandmother, when I was a baby, said that she always went like this, and that's why I turned out to have such a beautiful nose. I was like, I'm not so sure, Grandma, but okay. And I made it much prettier when I added just a little bit of filler here to the tip. And
5 seconds instead of 10 years of
10 years of her, like, holding my nose up. Or I don't know if she did it for 10 years, but certainly while I was a baby, so maybe, a year or two. I don't know. Anyway, you add a little filler here, you do the Boston tip flip, and there you have your beautiful nose.
I think the key thing about do-it-yourself is it's like everything else. So you can do your own plumbing at home, right? I've done some of my own plumbing at home. And it goes fine for small things if you kind of know what you're doing pretty well. But you also know you're taking a chance, right? Because you can say, I'm going to install this little device, and then you go and turn on your sink, and all of a sudden you have a flooded basement and you need a new house. Because, I didn't know about the...
But I have really good insurance in that.
Yeah, I didn't know about the the sprocket flange that I needed from the Kugelmeister.
Yeah.
Those kinds of things that goes on the part there. So there's a reason that you need to be licensed and know these things. And it's because trouble can occur. But there are things that you should be doing yourself at home, right? So certain things that you do in the evenings, certain things you do in the morning, part of your home regimen.
Absolutely. Cleanse your face with the cleanser, never soap. Hydrators first, right after the cleanser. And then this time of year when it's a little bit colder, you can use a moisturizer at night. And moisturizer kind of keeps the elements, keeps you safe, but it doesn't change anything on a cellular level. That's where the hydrators do. So you definitely want cleanser, hydrator, maybe a moisturizer at night. During the day, I always say first thing is a moisturizing sunblock. So on top of the hydrator. So it is
There's
important
plenty of
to
stuff
keep,
to do yourself.
Yeah, so there's plenty of stuff to do yourself, and as long as you keep it safe and that you...
So the hard part is finding someone to do that stuff for you. Put on your creams every evening and morning. That'd be really hard.
But there is one thing that people are doing at home, which I think is not so bad. They're doing the LED, like the red light therapy. As long as you know and you follow directions and you do it just correctly, you can. Sometimes
That
those
can be
things
helpful a little bit.
So those are, if you
there are
have the
some
time.
home things that are much more mild than the industrial versions, like the ones we have are stronger of these kinds of machines, and they're more effective. But yeah, you can have some benefit from the home version for sure.
So if you have the time and you can do LED at home and every day or every other day or once a week or something like that.
If you really want to do it yourself, you see we're here in the operating room. Come on over. We'll let you have a couple hours in the operating room. We'll get you some equipment and go for it.
Yeah.
That part was a joke.
Yeah.
Well, thank you for listening to Plastic Surgery Secrets Talk.
I encourage you to actually write some questions. If you have any questions, write them right here and we'll try to answer them. Like if you have any questions about at home.
Write them down yourself. Do it yourself.
Considering. Yeah.
If you'd like what you've heard and you want to get in contact with us with questions or other things, you can call us at 617-566-3223.
Or email us at info@drspiegel.com. That's DRSBIEGEL.com. Or follow us on social media. It's always Dr. Spiegel.
At Dr. Spiegel. We'll see you next time. Or you'll hear us next time. Same thing.